Hello everyone and welcome to AceOSCE's video for today. I am Alicia and thank you again for joining me for this video. In this video, I just first of all want to let you know that this is a longer video than usual, so this is around 20 minutes. It does take me a long time to go through the topics that may be asked for you in the evaluating exam, but I really wanted to be thorough so everybody knows what to expect. I want to go through that, and then I also want to kind of give you a few tips and tricks, a few pieces of information that you guys asked me for at the end of the video, and also just to kind of let you know what I usually do and how I could try to help you guys out. And again, feel free to ask me any questions in the comments, maybe even DM me if you have any specific questions about any topics, and I can try to help you out. I will today go through all the topics that evaluating exam tests us for, and this is directly from the PEBC website, so that is the official source. I want to kind of give you a little idea about each topic, especially for the people who are new and haven't given the evaluating exam before, just to give them a little more insight into what is expected out of them, so that they know what they should study for, what they should focus more on, and a few answers to a few questions that most or at least some of you have asked me either in the comments or by DMing me, just to kind of let you know what are the common answers to the few questions that have been asked, because maybe you guys have the same question, maybe two of you have the same question, and in this video I could help answer that. So I'm going to go through the first screenshot from the PEBC website that shows us the basic blueprint of the evaluating exam syllabus. So here you can see that there are 4 major categories out of which you will be tested on the evaluating exam. The first one is going to be biomedical sciences, which is 15% in weightage, pharmaceutical sciences for 25%, pharmacy practice for 50%, and behavioral, social, and administrative pharmacy sciences, which is 10%. Now, this is a total of 100% of the evaluating exam syllabus. I will go ahead in the video and go through the breakdown of each of these topics and what they have, what sort of questions they can be asked from each topic, and which ones are more important. I won't say which ones are more important because everything is important, to be honest, but what are things that you may want to focus a little bit more on, because I've seen that some people are better at some topics and some topics are more difficult for the general public than the others. So there's one little point that I wanted to raise, that whenever I ask you guys questions on the group, I have really straightforward questions, like what is the side effect, or what is the contraindication, or what is the answer to this question. In the evaluating exam, they're not going to ask you those straightforward questions, They are going to be giving you a case-based scenario. They're going to twist and turn a question around, and it's not because they want to make it harder for you. They just want to see how well you as a candidate or as a pharmacist can understand a question. So keep in mind that you have the answer in front of you, just read the question well. Now, one question that a few people have asked me is that if you just need 60% to pass in your evaluating exam, why not just study really, really well for the pharmacy practice, which is 50%, and study a little bit for the others, and then you're sure to get a 60% mark? I mean, that is a very valid question. It's nothing wrong in asking that. Now, there's 2 reasons why you don't want to do that. The first reason is more of a moral reason for me, because you are just starting out in your PEBC journey and you're giving your evaluating exam. You're not going to stop here. You want to do your MCQ and your OSCE. And in the MCQ and OSCE, there's no 60% passing, there's no 80% passing. You have to be better than the best. You have to be in the first 200, 300, 400 to pass. It's a bell curve exam. So you do want to be best at every topic that you're tested on, and the evaluating exam makes the basis for you for that. So you definitely want to be good at each and every subject that is being tested in the evaluating exam. The second reason is that even if you study really, really well for the pharmacy practice, like 100 on 100 sort of thing, you have no guarantee that when you go for the exam, all the questions will be understood by you. You will know the answer 100% for sure. So definitely study really well for each topic. Let's have a quick look at biomedical sciences. So out of the 15%, you'll have questions from biochem, you'll have questions from genomics and molecular biology. So biochem is basically going to be just your biochemistry that you've studied in your bachelor's. Your molecular biology, so the structures of molecules, you do want to make sure that what are the molecular levels of each, even in terms of your atoms and your electrons and your protons. Your physiology or functional anatomy. So I did ask a few questions out of anatomy in terms of the longest muscle, the shortest muscle, the fastest muscle, even just the structural things like, how many brains are in the cranium, things like that. You do want to make sure that you're good at that. Immunology, so basics of your immune systems, your immunoglobulins, your lymph nodes, everything like that. Medical microbiology, so this is going to be a big one because when you go into your pharmacology, you'll see that you need to know the pathogens for most important and most common say conditions, say pneumonia, typhoid, tuberculosis. So that all comes under microbiology because that is the fungus, bacteria, or the virus causing that disease, and that is the starting point of studying any disease, especially in pharmacology. So you do want to focus on the microbiology part and the anatomy part really well when you look at biomedical sciences, especially because from medicinal, I think, microbiology, I even remember seeing some case-based questions when I was discussing them with my students who are studying with me at the moment. So you do want to make sure that this is something that you're strong in. You do want to keep revising this again and again because I know it's hard to memorize all your different sort of bacilli, your different sort of gram-positive and negative cocci. But believe me, there will be a few questions asked in the evaluating exam from this topic. And you don't want to leave this one because it is a very easily scoreable topic if you know the answer. So definitely have a look at that. Now the second one for 25% is pharmaceutical sciences. Now this does have your pharmaceutics and drug delivery systems. So the PEBC does expect you to know the difference between the drug delivery systems. For example, your IVs, your transdermal ones, your CR, XR tablets, even your SL tablets for that matter. What is the difference between the bioavailability of these? What is the advantage of one over the other? So they do expect you to know those. Pharmacokinetics and biopharmaceutics. So how the pharmacokinetics of a medication will affect your body, the drug concentration. A lot of calculation-based questions can be possible from this specific topic. So you do want to kind of keep an eye out for that. I know that a few people do struggle with this. I'll try to make a short video on this, but again, you need practice. The video can give you an overall idea of what it is, but again, joining some sort of discussion classes or being a part of a group that usually goes through these on a regular basis, even a weekly basis, is a good idea. Then comes medicinal chemistry, which is medchem, which is usually going to be the structures of medications and classifications. Your pharmacology, which is I'm going to be discussing in the next one, in the next section in pharmacy practice, because this is a huge one. You've got your right from the pathophysiology to the therapeutics. This is going to cover everything. So you have to be really, really, really good at this, and this is the biggest thing that the MCQ tests, according to me. You have your toxicology, biotechnology, pharmacogenetics, which is something that I don't see a lot of questions from, but you do want to keep an eye out for that because it does have your basic toxins. You have what are the causes of basic pharmacogenetic trivias. So keep an eye out for those. But again, I wouldn't say it is one of the most important things, but I don't want to say it isn't either. Just an FYI, according to me, in the medicinal chemistry section, I know that it was really, really hard for me to understand and memorize the structures. So I don't think they ask you a lot of structure-based questions. Of course, if you are someone who can memorize structures, nothing like it. Definitely memorize them if you can. But if you cannot, don't be too hard on yourself. Focus on the other areas more because I think they will usually just have a few questions from that topic. You don't want to miss them. But if you can't do them, don't kill yourself after it. Also, do know your classifications really well because they will definitely ask you a few questions in medchem for your classifications, be it second generation antihistamines versus first generation, their side effect profiles, even so that the classification of PPIs within the same chemical structure, just the difference of say a phenol atom or just a sulfur atom or entity. So keep an eye out for those. So medchem, kinetics, and ecology are big in this topic. Now pharmacy practice, this is a huge one, as all of us expect. So out of the 50% of the pharmacy practice, there are two different sections, the clinical sciences and professional practices skills. Even though professional practices skills is only 15% is still a big number. Also, they've made this into a separate area on its own, which means that they really do focus on this as well. So I will go over that with you as well, but don't just let it be because it's basic ethics and law. It's a very, very big, huge thing, even in your regular pharmacy practice. So I'll go through the clinical section first. So out of 35%, you are asked about the drugs or the condition's pathophysiology, which is basically going to be the diagnostic tests that you would need to do for basic conditions to make sure that that is the case. For say H. pylori infections, or the urea breath test that you do, so pathophysiology for that. Blood tests, stuff like that come under pathophysiology. Clinical biochem, lab and diagnostic testing. So what is the criteria of deeming if a patient is diagnosed with, say, diabetes or Alzheimer's? What are the blood work that you need, the lab tests that you need, the levels that you need? Those are some things that they would expect you to know, a huge topic for MCQ as well. So pharmacotherapeutics, including prescription, non-prescription and complementary therapy. So in the EE, the PEBC would want to know if you know how to treat basic conditions, what are the basic medications needed to treat a condition, what are the over-the-counter medications that you can potentially recommend for such patients, and also what are the other lifestyle modifications that you may recommend to the patient in order to either prevent or treat or at least improve a certain condition. So these are some things they would want you to know. Health promotion and disease prevention. So this is all of your vaccines. This is all your lifestyle modifications that you can share with the patient to either avoid a certain sort of disease or at least prevent it from happening. Patient care processes, where there is assessment, intervention, monitoring, follow-up and documentation. So assessment, as in what are the things you want to look out for when a patient comes. A lot of case-based questions come from this, especially in the MCQ as well. What is the intervention? So as a pharmacist, what is your scope? What can you do as a pharmacist in terms of even referring to another healthcare professional would be an intervention for sure. Monitoring, so how long do you usually wait to see if the result is there or not? Is it 3 to 5 days? Is it for like few weeks? Like there are antidepressants that take a few weeks to show an effect. And the follow-up, as in when would you want to follow up? Is it a trial of 4 to 6 weeks? Is it a trial of 3 to 4 days? So different things, different drugs, different medications, different conditions have different monitoring, follow-ups and interventions. PEBC does expect you to know them. And one of the big ones is documentation. I think I did ask a question about DAP documentation as well. So what are the different styles of documentation? What do you want to document? In what scenario? Things like that you do want to know. Special populations, including geriatrics, pediatrics, pregnancy and lactation. A huge topic in the OSCE. There will be a patient who comes in, will be pregnant. If you don't ask her, the case can go haywire because you probably will recommend something that is not suitable for pregnant ladies. You have geriatrics, which is usually patients who are going to be over 65 years of age. Lactation, so that is breastfeeding ladies. Pediatrics, that are kids usually under 12 years of age. And then there is nutrition. So nutrition is variable, can go from a patient who is either 2 months of age, cannot take anything oral for eating. For example, just recently we had a huge backlog or a back order of infant formula. How do you manage that? What are the other alternatives you can give? What are the things you can give to a patient who has an NDG who's not able to eat something from the mouth, or maybe even a patient who's in the coma and doesn't have a way to eat except for an IV tube, So that is all going to be a part of nutrition. The second part is going to be professional practice skills. I want to emphasize a little bit on this because we usually don't see this in bookish knowledge. This is mostly practice-based, and this really is helped by discussions that we do in our classes, and even just having a little go-to section as to what happened in our pharmacies today and how we discuss things that happen in one of these topics. So prescription processing and product preparation. So that's going to be including sterile and non-sterile compounding. So the whole process of getting a prescription, how you process it, very different from India, from where I'm from. Like there you just go to a chemist shop, you ask for 10 tablets of amoxicillin, the person cuts out 10 capsules of amoxicillin, gives it to you, you go back home, hunky-dory, that's it. But here it is very, very different. If anybody has worked in a pharmacy, you'll know that things are very stringent and regulated here. You do need a prescription for most antibiotics, and you go in the pharmacy, The pharmacist is responsible for checking if this medication is appropriate for your age, your gender, the indication that you've been prescribed this for, and if there's any allergies for you, any contraindications, and if it is suitable with your profile of medications and conditions. After that, you go ahead and you process the prescription. You prepare the product in terms of either a compound or even a specific medication like tablets or capsules, and then you counsel the patient and you follow up. So all of that comes into this topic. Then comes prescription calculations. So it can be compounding calculations as to how much powder you've got to mix in a specific cream to make up a certain concentration. It could come into play of a case-based scenario where you have to find out the number of tablets that you have to dispense for a patient, especially if it's a taper down or a taper up dose. So things like that, where it seems like a complicated thing, but as long as you know your basics, it's a very easy calculation. Then comes communication and patient counseling, how you would want to counsel the patient, how you would behave in a professional setting with the patient. There may be case-based scenarios where the patient doesn't know your language or is in a hurry. How are you going to deal with him? Are you going to send him without counseling? Are you just going to give him some sort of written paperwork? How would you counsel the patient? So case-based scenarios out of this. Drug information. So basic knowledge of the basic drugs and basic side effects of basic medications. I would say this is a very general topic. So as you go through each condition, each disease, you will have more information about drug information for each. Then there is literature evaluation, research methods, evidence-based decision making, including pharmacoepidemiology. I will go through this a little bit more later on. And then there is behavioral, social, and administrative pharmacy sciences. So here you have all your marketing, your quality improvement, your financial, pharmacy management, personnel and workplace safety. And this is not just for the patient, it's for the pharmacy employees as well. How you deal with medication errors, why there are staffing shortages and how you can address them. Things like that are going to come in pharmacy management. Again, a big chunk of this is practice-based, not learning-based. So definitely discussion classes help with that. The Canadian healthcare system, which is markedly different from that of the entire world, because mostly patients in every province at certain age groups at least are covered or helped by federal governments and provincial governments for their medication needs. So this is going to give you a little brief idea of that. Pharmacoeconomics and biostatistics, which gives you a little idea about how the Canadian government statisizes and puts economics in the pharmacy business. If any of you are a little more interested in going through the syllabus a little more in depth, there is this section where there is a revised syllabus PDF for the evaluating exam in the PEBC website. Now, this is a very big document, so if somebody's really interested, it's about, I think, 80 pages or 75 pages long. Definitely go through it if you have the time. I just wasn't able to attach it because it was too big of a file. Now, I think there was a little bit in the social sciences sector which I forgot or did not get time to go through. It had law and ethics, and it had some sort of communication as a part of the evaluating exam testing topics as well. Now, those are big topics, especially in terms of laws, in terms of what you can release, or sort of information of a patient you can release without their consent. What are the ethics you would have to uphold in certain criteria? So again, discussion classes for that definitely help. Now, I did also get this question a lot from you guys. Where do we study from? A lot of you DM'd me and stuff. So I just want to address that here. So again, thank you guys for joining me. But I'm just really new in this. I am trying to help out as many people as I can from the information that I have after I gave my own exams, and from what I have known from other people who have just given their exams. So I don't have my notes myself right now, but I'm trying to make notes on certain topics which have been requested by students who are in my class right now. So I'll keep on updating you if I have notes for certain topics or not. But as of the moment, I don't have any topics that you can study from. I do have these mock tests and questions which I'll let you know about later on. In the meantime, according to me, again, it's a big disclaimer, but this is according to me, what I think is right. It may vary with your needs. There are usually two big or good options. If you are someone who has just passed out from your college and your basic bachelor's is very clear and fresh in your head, and you just want to review quickly in the light of evaluating exam and what they can ask you, In that case, MISBA quick review for evaluating exam is a good idea. You can source that from the MISBA website, and I really found that helpful when I was giving my exam because it just outlines the basics. But if you're someone who really wants to revise in depth, someone who has maybe forgotten most of their basics, going in for the PharmAchieve option is a better one. It is a more in-depth evaluating exam material. I also wanted to let you guys know what I do. So for the students who have enrolled with me, thank you so much. And for the new ones who are here, just letting you know that I usually take topic-wise classes for people who are struggling with certain topics and want help only for certain specific areas, because I know that I'm able to look into those areas and help you out the best in those cases. So if you find any problem areas, you can definitely come out to me, reach out to me. We have discussion classes once in a week, and I can definitely look into the notes for you and help you out with that. I do have introductory mock tests and discussion classes that help people revise their basics. I have weekly doubt clearing classes as well and mini mock tests based on those topics that we revise, so that you know that you're not just revising that, but you're also going through the questions around that topic. I also know that people are different. You may be different than me, and someone else may be different than you. So what you may need is different from someone else's needs. So what I usually do is I try to ask you, or I try to assess what you are weak in. I point that out to you, and if you do want to kind of work on that, I work on that with you in terms of giving you more information about that, giving you more resources to read up on that, even doing some mini mocks for you and going through those areas specifically for yourself. I also wanted to take this opportunity to let you guys know that we're almost 80 members big, which is a small number for most people, but I did make up a little mini mock test, and I have touched and covered most basic topics of the evaluating exam in those 50 questions. They range from ethics to law to calculations to pharmacology to a lot of other topics that we discussed about today. And this is a good start for anyone who wants to assess how well prepared they are for the exam. I am also hoping to do a group discussion that will follow to discuss the answers for those mock tests and clear any doubts. And any tips and tricks that I can share with you for answering your questions quicker or understanding the questions better would be a good idea. Just FYI, I think you know it will be usually a 1 hour long sort of mock test plus discussion class where you will be asked to do the answers in front of me, so you cannot go out and cheat. Now, just wanted to say again, thank you so much for joining my group, and thank you for watching this video. I know this was really long, but as usual, feel free to comment down below if you have any other questions for me regarding this video or any further questions. I know that someone did request me to make a video about a certain topic, and I got a couple of other DMs. So I'll try to cover those topics. Again, topics that I cover in videos are very vague, so definitely join my discussion classes if you'd like.